partnership with the Sickle Cell Foundation Nigeria and in honor of the blessed memory of our beloved Tosi Buckner. My name is Thelma Illams, and our doctor in the house today is Dr. Tunji Alakija. It's good to have you again on the show, sir.
Thank you very much, Thelma.
Happy New Year.
Same to you.
How does it feel to have made the new year?
Beautiful.
Beautiful. Okay. So Dr. Tunji Alakija is a medical officer working with the Sickle Cell Foundation Nigeria, Idiaraba Surulere, and he graduated at the College of Medicine, University of Lagos in 1977, and later proceeded to the USA for the postgraduate course. He worked for the Lagos State Health Service Commission at the Paediatrics Department of various hospitals, Marcy Street Children's Hospital, Ekpe General Hospital, and Oniko Health Center till he retired in May 2016 and then joined the Sickle Cell Foundation Nigeria. He is the pioneer founder of the Pediatric Sickle Cell Clinic of Ekpe General Hospital in 1992, and then also the pioneer founder of the Sickle Cell Clinic of Oniko Health Center, Lagos, and also trained as a genetic counselor in sickle cell disorders, and his special interests are care and management of children with the sickle cell disorder. You're welcome again to the Inspirations of Neighborhood.
Thank you.
Today on the show, we are debunking myths about sickle cell disorder, and I just want to go, yay, finally. So this is something that every single person can be a part of. Why? Because it's not just, you being a person with a disorder, or you being a person who has someone who has a disorder, but as an individual, who probably has nothing or the other to do with sickle cell at the moment, but you've heard a lot of things, and then you're wondering, oh my goodness, is this a death sentence? Oh my goodness, this actually happens? Why? This is the show, this is the time to actually have those your questions come through to Dr. Tunji Alakija, and yes, he'll be debunking a lot of claims, and of course, if they're true, of course, why not? He will tell you if they're true or not. The number to call to be a part of the show is 0700 923 923 923. On WhatsApp, it is 0817 313 6193. Myths about the sickle cell disorder. What are your fears, concerns, questions? Where have you wandered to? What have you imagined? Let us know. Dr. Alakija, what is the common myth there? Should I go with the one that I think that is most common? So most commonly, you really get to hear that persons with a sickle cell disorder do not last until, do not last after a certain age. Some of the ages that I've heard, you hear 21, you hear 16, some you even hear as low as 2 years old. They tell you if you're able to make it to 5, well, good for you. But once you have your 16th birthday, and you find people actually thinking of writing wills or writing a letter and things like that. Is this actually true?
Thank you very much, fellow. This observation is you're correct. I've heard it myself when I was still in the medical school. But people with sickle cell, they don't live till 21 at the most, and they die. Well, it's not really true. In fact, it's not true. These days we have seen many, and we still have many sickle cell patients who they've lived long, 40, 50, 60, 70, 80. Even the oldest sickle cell patient in Africa, and I suspect in the whole world, is a Nigerian.
Oh.
Yeah.
Really?
She's a lady.
How old is she?
She's 94.
94?
94 years old.
Would that be Mrs. Moduko Popola's mother?
No.
No, okay.
Yeah.
I think she's in the 80s. I can't remember now, pretty much. Okay.
This is Alakija Oniko.
Oh, okay.
She's 94. So it's not true, and we need to debunk some of these false. So it puts people in fear, and so in the good old days, you see, they don't have too much knowledge of what is really happening. And in the good old days, the medical knowledge and the care available is not that much. The health personnel, that know about the management, they are fewer in those days. But now we have a lot of health personnel who know about it. They know about the causes of sickle cell disorder. And so we know what to do.
Right.
It's because they don't know the causes that they are not given the right solution. But now we know the causes of it and the things that bring crisis, some of which can be fatal, really. So we know what to tell them, things to avoid. So it's not true that they will die before the age of 21.
So science has evolved and persons are more enlightened. Okay. So I went with mine. What's yours? What is, let's look at some of the myths out there that you've also heard as a doctor in your field.
One of the major things is that the origin or the cause. It's a very strong one, especially in Africa with our cultural beliefs.
Right.
Most people, I remember when I was at Ekpe and I went for the sickle cell work there. Most of the mothers I interviewed, they tell me it is caused by supernatural evil causes. And I'm telling them, no, it's a blood disease. And they say, no, it's not. It's from the supernatural.
Do you actually have people to say that in this time?
They still do, but they are getting fewer.
Okay.
Because knowledge is getting even to the rural area little by little. And they think that it's caused by people who have offended the gods. They think that this is Obanje. They feel that this is caused by witchcraft. All those kind of things. And so it's not true, listeners. It's not true that it's evil supernatural. You see, even the word that they sometimes use, look at the Yoruba one, abiku. For those who speak Yoruba, abiku means born to die. Abiele lati ku. This one is born to die. So it's not true. Because why they say so is that in some of the families, really, 1, 2, 3 children that come, they resemble each other. They resemble the sickle cell patients. Some of them resemble each other in the same family. So when one is born, and due to infant mortality that is high, that one dies. And another one is born, and it resembles the first one. They say, is that one that died that came back? And is going to die. And it's true. The second one dies again at the age of maybe 1 year. And the mother has another one. And it resembles those ones who had died before. And they say, is that one that came back again? Is here to die again? Abiku or Banji. All those kind of things. And so it's not true. It's a blood disease. It's not supernatural evil. It's caused by some fault in the hemoglobin of the blood. The hemoglobin in the blood has some faults. So we need to correct that one that is caused by supernatural evil. No, it's a blood disease. We need to know that.
Okay. We might also want to clear the fact that the child actually got it from your parents and not from the heavens or from the village or anywhere else.
Yeah.
Okay. So another one that we might want to look at is how people actually, just seem to think or assume or condemn that traits or no traits, sickle cell is sickle cell. And they believe that the persons who have the sickle cell traits also suffer the same complications as those who have the sickle cell disorder. Is this, anyway, is there any truth in it at all?
There's no truth in that also. There is something we call trait, which means that it's not the full-blown sickle cell disease. In fact, it's not a sickle cell disease. It only means that it has some portion, 1S of the genotype. The genotype has 2 components. And so this trait means that he has one normal hemoglobin pattern, A, and he has one of the sickle cell, S. So it's like it's half 50% affected. So we don't classify that as sickle cell disorder.
Okay.
And they are virtually normal in the real sense. They can do anything that AA people can do.
They don't at any point in time suffer any complications whatsoever.
They can when they are subjected to certain bad conditions, as I'll put it. Normally, they are okay. But for instance, when the oxygen where they are staying is very, very low, they can go into crisis, mind you. They can begin to have pains and all the other things that sickle cell patients have.
But that is unusual, right?
Well, it's unusual if oxygen is okay.
Okay.
And that is why in airplanes today, in the whole world, they will not employ anybody to be a pilot who has AS, a trait, because the oxygen can fall, although it doesn't normally do so. Aeroplanes are well equipped with stable level of oxygen. But in the good old days, where the knowledge is not that like we have it today, some aeroplanes, occasionally the pressure in the air cabin will go down, and then anybody who has AS, it endangers the pilot. So they don't employ anybody who has a trait.
Okay.
And if you're even running, doing physical exercise and running, in some of these military people, police, they want to employ their members, they subject them to all kind of serious exercises. Somebody who is AS, he may not even know his AS, or he may know his AS. He may not know that serious physical exercises, he can go into crisis. Yes. So AS, normally okay. But when some bad conditions are prevalent, then it can go into crisis.
Okay, 17 minutes before midday. Lagos, be a part of the conversation. The number to call is 0700 923 923 923. It is Surviving Sickle Cell, and we're debunking some myths as it regards sickle cell disorder. What are these things, some of these things that you've heard over the years, and you've just wondered if it was true or not, or you've just gone outrightly to just believe it and just take what it is that you hear? Let us know what they are. The number again is 0700 923 923 923. On WhatsApp, it is 0817 313 6193. Hello, good morning.
Yeah, good morning. Daniel is my name.
Good morning, Daniel. Where are you calling us from?
I'm calling you from Alakija.
Okay, go ahead, Daniel. Talk to us.
Yeah, I was just listening to your program, which says that airline doesn't employ AS band people. That's not true. Because I'm an AS also, and I'm a pilot. Yeah, that's not true.
Okay.
Hearing that for the first time in my life.
Okay.
So that's not true.
Okay, thank you so very much, Daniel. But what I think that the doctor was trying to say was trying to actually clarify that while persons with the sickle cell trait are not exactly in danger of complications the way the sickle cell disorder persons suffer, people take precautionary measures. So I'm sure that while some airlines actually take that precautionary measure to make sure that, yes, in the event that something actually goes wrong with the airline or with the aircraft, they would rather not endanger lives of persons, with a sickle cell trait. All right, but thank you so much for your observation. We thank you so much for that clarity. 15 minutes before midday, it's 92.3 Inspiration FM, debunking myths that come with sickle cell disorder. One of the ones that I have often heard or people have asked is sickle cell disorder for the blacks. Is it a disease of a black man?
That's correct.
The question or the answer to the question? That people actually ask that, right?
Okay. The whites don't normally have sickle cell disorder. It's a disease of those of black origin. So in USA, for instance, the black Americans who have descended really from Africa, they do have it, but not those who are pure white. They have nothing to do in origin from the black people. So it's a black man disease actually.
So there's no one white man out there who has the sickle cell disorder
Not
that
really.
you know of.
Not really. Except you can trace that the origin has some origin from black Africa or the black people. It's a black man disease actually.
Okay. Some persons have also said that they would want to think that persons with sickle cell disorder are drug addicts because of the pain that they go through and then the number of drugs that they have to take and ingest and all of that. What do you think about this?
You are correct in the sense that they go through a lot of pain and they have to be given pain medications to calm down the pain and so on. We know this, and that is why we tell them to be careful the kind of pain medications they take and how frequently they take it.
Mhm.
So the possibility of that is true. Even in the hospital, we need to make sure that they are being treated by experts, those who know about it.
So the drugs are not abused.
Yeah, not abuse, even in the hospital. Because sometimes when you give the drug for the pain, within 2 hours, you can see the patient is screaming and say, "Doctor, I'm still in pain. I want more drug." And sometimes you have to be careful because some of these drugs are addictive drugs. And a junior doctor may want to give another one because the patient says, "I'm still in pain." And you have to be careful. So drugs like morphine and those kind of things, you need to be careful how much you give. You can't really be giving morphine every 1 hour because the person is complaining. So it's possible for them to be too dependent, as I would say, on drugs because of the pain.
Okay, let's take this call. Hello, good morning. Okay, I think we lost you there. Do try to call us back. The number again is 0700 923 923 923. Okay, we're going to take a break. Okay, let's take this call before we go on a break. Hello, good morning. Are you there? Hello, good morning. Okay. Do try to call us back. You can also reach us on our WhatsApp platform if you cannot reach us via the phone lines. The WhatsApp number is 0817-313-6193. 0817-313-6193. We'll be back after this timeout. Disease?
No.
In any way whatsoever?
No. It's not communicable. You can't say, "I want to shake this person and that other person has it." You can't say, "Because I'm a sickle cell, when I cough and somebody's name." No, it's not. It's a genetic hereditary disease. In other words, you yourself that has it, you get it from your parents and you get it right from birth. You can't communicate and give it to another person.
So it's not even transmittable, even through, it's not transmittable in any way.
No.
Okay, all right. So that just doesn't happen. Does sickle cell ever skip a generation? Is it possible that a particular generation to come is just void of sickle cell disorder?
If you know the inheritance pattern, you'll know that the person or the couple at risk, for instance, who happen to come together to have a baby, if by random selection the lady gives or donates the S part of our the man donates his own S part of the hemoglobin, they will then have the sickle cell disorder child. And it's possible, definitely possible, to miss a generation, 2 generations, 3 generations, if by pure chance the good part of the genotype A comes and mixed with the good part in the other woman. And then in the next generation is the A and the AS, or the A and the A, and they may just keep missing it. So it's a probability thing. It's possible to
So there's a chance.
There's a chance, definitely.
Okay. So we're going to take a break right now. When we come back, we'll go back to the phone lines. Remember, the number to call is 0700 923 923 923. What are some of these myths that you've heard, regarding the sickle cell disorder? Can we actually take this? Hello, good morning. Hello, good morning. Are you there? Hello, good morning. Hello, good morning. Okay, so we're going to take that break. I'll be right back.
Stay connected.
Episode on the show Surviving Sickle Cell, a show in partnership with the Sickle Cell Foundation Nigeria and in honor of the memory of our blessed Tosi Buckner. My name is Thelma Illems, and I've been doing this with Dr. Tunji Alakija, a medical officer working with the Sickle Cell Foundation Nigeria. And we have been talking most interestingly about myths concerning sickle cell disorder, and we have mentioned quite a few. Okay, I'm afraid we just might not be able to pick any more calls, but I like second chances, so I'm just gonna take my chance again. Hello, good morning. You're our last caller if it actually comes through. Are you there? Are you there? Okay, that call's just not coming through. I apologize. And let me look at the messages. Do we have any messages here? No. Okay. Dr. Alakija, what other myths would you like to look at?
Very quickly, another myth that is important is that sickle cell patients, the ladies, cannot have their own children. And the mothers are very, very afraid of this. That will my daughter have her own children, and she's worried. Let me quickly let you know that they can really have their own children, and they have always had their own children. One thing I'll say is that the only important thing is that during the time they are pregnant, we have to make sure that they are well supervised in a good antenatal care, where doctors not only know about obstetrics and gynecology, but we link them with doctors who know about sickle cell to partner with the doctor that is taking care of them. And it's very important. At that antenatal stage, they need to take their blood and do all kinds of things and give some medications which are peculiar for sickle cell. And then more especially when they want to now give birth during the labor, is so important that you have a doctor there who knows about sickle cell. It's important to have oxygen around. If you don't take all these precautions, the patient is very, very likely to he may die, both the mother and the baby. But with good precaution, good doctors being around, or getting all the blood ready, many of them will do well. They will deliver normally, the mother will be okay, and the baby will be okay. And so they can surely have their own babies.
What else is there? One more. Is there any other myth?
Another myth is that you cannot really diagnose it, sickle cell, until the baby is born. Another myth is we can't diagnose it. We have what we call prenatal diagnosis, in which when the mother is still having the pregnancy, we diagnose and we know the genotype of the baby even before the baby is born. Another myth is that in this disease, the person will just continue to have problems throughout his life. Problems, and there's no way to be free. It's not true. These are days in which we have all kinds of medications we can use to reduce the problem the person have. And of course, we have bone marrow transplantation. And once the bone marrow transplantation is successful, the person is 100% free throughout his or her life. So he doesn't need to continue having pain and problem of sickle cell. If we have it abroad, and we are going to start having it in Nigeria in our own Sickle Cell Foundation this year. And once it is successful, bone marrow transplantation, the person is free, at least blood-wise. Although genetically he still is sickle cell patient, he can still transmit it to his own or her own children.
So just in case this very latter part of what you just said sounded like a lot of, jargons. Sickle cell disorder, is it a death sentence? Is there a cure for it? Is there a cure for sickle cell disorder?
There is a cure. There is a cure. Bone marrow transplantation
is the way to
the
go.
Cure.
We have to go. Thank you so much, Dr. Tunji Alakija. Join us same time next week. That is Saturday at 11:30. We gotta go now. The world news is up at the top of the hour with Dear Cordobit. My name is Thelma Illiams, and I'll be back on the tea break on Monday at 11 a.m. Have yourself a wonderful, wonderful weekend.